The Palm Beach Civic Association expands its communication outreach with a state-of-the-art television studio. We call it Studio 33480, the zip code for the beautiful island of Palm Beach. Sponsored by Finley Galleries, our goal is to bring you in-depth interviews with the most colorful and knowledgeable personalities on the island. And now, our host.
Welcome to Studio 33480. I'm Sally Lewis with the Palm Beach Civic Association, and joining me today is Judy Goodman, Chair of the Healthcare Committee, and we just wrapped up the first meeting. What are some of the topics that are coming up?
Well, Sally, our committee, the Healthcare Committee of the Palm Beach Civic, is probably a super busy committee because we've taken on so many issues over the last couple of years. When we all left at the end of the spring in May, the COVID situation was spiraling up again, and we were wondering what was going to happen, but we luckily have seen a decline over the summer, and now there is the news of the booster shots are all in town at the commercial ventures, whether you're going to pharmacies or Publix pharmacy, they're available. So you can get that new booster that's been re-engineered to be good for all of the different variants. They are available, but you do have to get online to schedule them or make your appointment through your local CVS's.
And it's, from what I'm understanding, 12 and up.
12 and up for the Pfizer, but from my reading, it's 18 and up for the Moderna. Some people have been switching them around, and it's I will let scientists discuss whether that's the right thing to do or not, but for those who want to stay with what they have already had, both of them are available now. They've both been approved.
It's good to have options right now, right?
Very much so, because it's going to be with us for a very long time. Luckily, not as virulent as it was, as we have seen as the committee did some information teaching on the antivirals over the summer. The Paxlovid has been effective in the 65 plus age bracket to help get people better sooner. And so with all these tools, we've got really an arsenal of things that we can use to make people feel more comfortable. The most important thing is they are not going to go into the hospital and have a real serious impact if they have been vaccinated and boosted, as medical science suggests that they do.
Good thinking on that. Good advice. You've got some events coming up, so that's going to be very beneficial to the public. Can you tell us a little bit about that?
The committee is really excited. One of our subcommittees, which calls themselves the New Trends in Healthcare, decided that they are going to try some live events, and they are going to be scheduled very soon, early in the season. We're going to have an event on November 3rd and November 10th. And the way these have been conceived, we're going to start with primary care. Primary care is like the gateway into healthcare, and many people are wondering when they come to town, who should be my doctor? Who is the right person to go to? All of the large systems seem to be getting into the primary care business and have primary care staffers, as well as individual doctors who provide primary care. So what the committee has decided to do is to do a wonderful event, which is going to start on November 3rd. Large systems that have a primary care specialty on their staffs are going to present, I believe it's scheduled late afternoon, to tell people, have the actual providers tell what makes their different, the way they present primary care, the distinguishing characteristics of why it's important and what they can get out of their particular system. And then the following week, they will do exactly the same kind of event, but with individual providers who are individual practitioners versus those who are affiliated with a large system. But it will be a good way for people to understand what opportunities are in town, what makes different groups distinguishable. Is it some are concierge, some are non-concierge, some are membership a subscription series. So it's a good way of finding out exactly what's being offered and what might be the right fit for you, because that really is the first place you go for care, your primary care, especially if you're interested in preventative kinds of things and don't need the specialists. If this if these two events turn out to be very successful, the committee's going to take it further and then do educational events with respect to perhaps the differences between ERs or the differences between different specialists. So it's a work in progress at this point, but we do know that the primary care, November 3rd, that's the first one to put on your calendar.
And also want to add that we'll be updating folks on social media, on the website, how to sign up, and we will also be recording it, which is really vital so that anybody will be able to watch the recording afterwards.
Right. It's intended to be an education piece to our, obviously our members, so that they know when they come into town that there are lots of choices in where they get care, what some of those differences are, and then they can make the best choice for their own families.
Excellent. Well, thank you so much, Judy. Thank you for the work you're doing, and thank you for updating us, and thank you for joining us for this edition of Studio 33480. We'll see you next time.
Studio 33480 is brought to you by the Palm Beach Civic Association, our sponsor, Finley Galleries, and our viewers. We welcome your thoughts on how our programming can best serve our members and residents.